Talk like this. Welcome to the Pearlii Podcast. Today we've got Dr. Kaejenn Tchia, private practice dentist from the Northern Territory in Australia, to tell us all about cold sores. I get cold sores, they suck. So I'm really interested to learn more about them, how maybe I can prevent them in the future. Dr. Kaejenn Tchia, thank you so much for your time.
Thanks for having me again, Carl.
I'm going to ask you straight off the bat, do you get cold sores?
I don't believe I've ever had an episode of cold sores before, but I definitely see them very commonly in my patients.
What do you do when you see one of your patients who's got a cold sore? Do you tell them?
Yeah, I mean, my patients will usually tell me that they've got a cold sore happening, because usually when they form around the lips, especially if they're on what we call the commissure, the corner of the mouth, they'll just warn me, both from just a disclosure perspective, but secondly, also when we're working on that, because they can be quite itchy and sometimes a little bit sensitive, it's more a warning spot to make sure we're not leaning our finger around that area or anything like that.
So you assume that they already know about that they have a cold sore. I remember when I got my first one, I think I was about 19. I don't know how I got it. Won't go into that. But I got my first cold sore and I went to the GP. I was freaking out. I thought my face was going to fall off or something. But I'd never heard of a cold sore. I didn't know what it was. So do you ever get patients that just don't know?
There are quite a few sometimes patients that, because they don't get traditional symptoms of a cold sore, like they don't get any soreness, during a dental checkup, you'll just notice that there's a crop of ulcers or like an ulcer on the lip. I'll ask them, does this ulcer worry you? And they said, oh, no. And then I said, oh, look, it could be a cold sore. And then that might then have a conversation about what a cold sore is.
Okay, I think the textbook definitions is herpes simplex type 2.
Type 1 is the most common one.
Okay, all right. Type 2, I think, is the particularly bad ones, like genitalia.
Correct.
It's like, yeah. Is it a cousin of type 1?
So they're just two different subtypes of the same virus, which is the herpes simplex virus, or HSV viruses.
Yep.
But the most common one that causes the cold sores is HSV1.
Okay, and can you just tell our listeners a bit about how you could catch this disease and maybe how common it is?
Cold sores, or HSV1 as a virus, is quite contagious, and the way it transmits is either on close skin contact, or what happens is the cold sore itself is a fluid-filled blister, and there will come a point where that blister will actually rupture and secrete, the fluid inside, and the virus can sometimes lay sleeping or dormant inside that fluid or inside that cold sore. Once it's birthed, it'll form a bit of an open ulcer, which will then usually crust in a couple of days, and then that will usually then resolve with no scarring within around about 10 days.
Is there a way that I can prevent cold sores coming on? They usually come, if I'm honest, when I've just been working too much, the stress levels, it's usually when I'm a bit run down. Is that a common cause?
Yeah, so the most common causes, one of them that you've just listed, is stress. There are some people where under a lot of harsh sunlight, where your skin gets quite dry, that can also be a cause.
Okay.
Other things as well that can be causes, it could be a lack of hydration as well, so dehydration, and also just not looking after yourself.
Can you tell us a bit about the treatment options available?
Yeah, so generally speaking, most cold sores don't need to be treated because they usually resolve on their own, and I usually just give the patients that reassurance. But there are some, if you catch it early enough, so as the blister's early forming and it hasn't burst yet, sometimes, or when it's just burst, you can use some antiviral like ointments and creams. What it does is it just makes sure that it helps to improve the healing of it and make sure that that virus can't continue to progress. So it's slowing down that stage. But generally speaking, as you said, you can use the any sort of lip balm, something that's going to keep it hydrated. Another great easy one is if you have ice cubes in the freezer, an ice cube.
I didn't know that.
That can also help.
So it's all about keeping it wet and hydrated. You don't want it to dry out. I actually thought it was the opposite. I thought you wanted to dry it out.
No, I mean, it'll naturally crust and then come off. But in terms of once that blister's opened, you want to keep it wet so that it's not chafing in, because when skin starts to dry, it can crack. And so you don't want that ulcer to get worse.
Oh, wow. And I do believe it is quite common. Do you have any stats you could possibly share on maybe the percentage of adults that have been exposed to HPV?
Look, I'm not a statistician, so I don't really know what the current stats are, but I can tell you that it is a very common thing. And so, if you do have it, don't feel ashamed. A lot of people get it, but one of the most things you can do, or the best thing you can do to make sure you're not sharing it around because it is so contagious, is if you are someone who has active cold sores, you get them, make sure that you're not having too much close skin contact. So avoid kissing your partner whilst you're obviously got a cold sore on because you'll spread it to them. Also sharing things like, whether it be food or anything like that. And also close contact with especially people with possibly a suppressed immune system. You want to make sure that's not happening too.
All right, great. Well, the reason I wanted to do an episode on cold sores, one, I get them. So personally, I hate them. And I wanted to get an expert in here. So for other people that are maybe ashamed or not sure about cold sores, I wanted them to not feel too bad. It is really common. It's not that big of a deal. It goes away in about 10 days after it bursts. So hopefully this episode has helped a few people out there. Me being pretty shameless about I get cold sores. Usually am pretty shameless on this show. So Kaejenn, thank you so much for coming on the show and talking about a pretty sensitive topic, but I think a lot of people out there would be really grateful. So thank you.
No worries. My absolute pleasure. Thanks for having me again.
And to our guests, please listen out for the next Pearlii Podcast. We release a new one on anything to do with the mouth every Friday on our Instagram. And don't forget to download the Pearlii app for a free dental checkup. Thanks again, Kaejenn.
Thank you.